Hello and Assalamu alaikum. Ultrascan Diagnostic. This is the CBCT of the patient that you had requested. This is the high resolution endodontic mode. On the 3D rendering, the area of interest is the lower left first molar. We can see that the lower left first molar has crown chamber opening and cavity present. There is also slight opening on the lingual aspect of this tooth. Now moving to the sagittal view. On the sagittal view, we can clearly see that the crown cutting has been done and the drilling has been done very significantly close to the interradicular area. Now we're going to move to the mesial aspect of this tooth first. On the transaxial aspect, here we can clearly see that we have two canals in the mesial root, the mesiobuccal and the mesiolingual, and both start separately but join to form one apex. This is 75 micrometers. We can see that they start separately and join at one apex. The chamber opening has been done and we can clearly see that it is still the orifice level. Now moving to the center of the tooth, here we can see that the chamber opening has been done quite aggressively and very close to the furcation area. So we have approximately 0.8 millimeters of sound tooth structure left between the drilling and the interradicular bone area. Moving to the distal aspect, here we can see close to the distal aspect that the drilling or the cavity part is very close to the lingual aspect, and there is a slight opening here present which is just above the crest level. This is going to be subgingival, but above the crest we can see this is the area where the doctor needs to be very careful, because this could be a source of bleeding, because this seems to have a little bit of a perforation in this region. Moving more distally, this is the distal canal. This one canal in the distal root, one very wide canal in the distal root, which is closing at the apex, and we don't see any apical ramifications. We do, however, see that the lingual plate in the distal part of the tooth is very close to the crest and can be a source of bleeding for this tooth as well. Now, if we look at the tooth from an axial point of view, which is top to bottom, so this is the cavity or the chamber opening. Moving further below, this is the orifice level, but just close to the furcation. So this is the furcation area. This is where the lingual perforation is when we were discussing it. This exactly here. So we haven't gone through the interradicular area yet, but it is very close, and there is signs of a lingual perforation towards the distal aspect of this tooth. So if you have any further questions, please feel free to reach to our team. Thank you very much.